Okay, so the last two are going to be our AC joints, and they're going to be imaged individually. But if it's a small patient, you can do it all in one. It just depends on the patient's size. Okay, so with the first ones, it's going to be technical factors of the image receptor is going to be 14 by 17. And the SID is 72, kVp range 75 to 85, MAS is 12, and it's going to be suspended respiration. The patient's going to be positioned up in the erect position. They're going to be standing or seated with their back against the bucky. And then you're going to center one AC joint to the center of the film. Okay, so about there. And you're going to have the arms hanging down by the sides. On the first film, the exposure is going to be made with the patient bearing no weight, and then you're going to move the patient so that the other AC joint is centered in the film to make exposures. And your central ray is going to go perpendicular to the body at the level of the AC joint at a 40, and then it's going to be a bilateral projection of both AC joints for comparison. And you're going to be deciding on a dislocation or not. Okay, so for the second AC joint method is going to include weights, and you would need to decide if there's a fracture before you do this, obviously. So you're going to put weights on each side of the patient's hands, and they're still going to have their back to the bucky. They must be standing against and upright against the cassette holder, and the AC joints are going to be less than 10 centimeters, and they must be both image and one projection. So the center of the mid-sagittal plane of the body is going to be the center of the film and have the arms hanging down with the weights. The exposure is going to be made with the patient bearing no weight on one film, and then on the second film it's going to have the weight so you can compare. The AC joints are done at 72-inch SID, and they're centered to the films. Let's see. And this will determine dislocation and separation and the function of the joints that are seen. The center of the ray for this one is perpendicular to the midline of the body at the level. And then the anatomy demonstrated is a bilateral anteroposterior projection of the acromioclavicular joints. The technical factors for this method with the weights is going to be an SID of 40, image receptor of 10 by 12, and a kVp range of 75 to 85 with an MAS of 12.